The CDC is working with public health officials across the country to find out what's behind a recent spike in hepatitis cases among children. Dr. Kumar joins us to talk more about what we should know. Good morning, Dr. Kumar. How are you today, sir?
I'm doing well, Amanda. It's good to see you.
So these hepatitis cases, I'm looking at the notes, 109 cases have been detected in the U.S. since last week. Is that enough for all of us parents, caregivers, teachers, what have you, to be alarmed, to be concerned?
Alarmed, concerned versus being on alert. I would choose the latter, being on alert. 109 cases across a population of 330 million Americans is still quite low. However, this is unusual. There's an uptick, and we need to be on alert and pay attention to our own children and our neighbors and educate each other so that we can look for these signs. Now, what's happened is acute hepatitis, a liver infection. Typically, this is from viruses A, B, C, or you can get something you eat, get hepatitis A, but this is not any one of those. These are hepatitis cases for which there is no known cause. They speculate, because 70% of these 109 children that you've mentioned tested positive for adenovirus. Adenovirus is typically a virus that infects the GI tract, causes a viral gastroenteritis, but it's not clear if the adenovirus is the cause of these acute cases of hepatitis. And so certainly further studies and research is going to be needed.
What do I need to look out for my children, and is there a particular age range?
Yeah, it's a great question, because the median age is 2, and so it's really young kids, and the oldest is 10. And so they're really the younger kids. And that's why when you look for associations, particularly on the heels of the pandemic, you wonder if it's COVID related or COVID vaccine related. And there doesn't appear to be any relation yet, because, these kids are too young to get the vaccine, and we're still investigating whether or not they've previously been infected with COVID. Now, when these children are sick, you're not going to wonder, they're going to be ill. They're not going to come downstairs ready to go to school. They're going to be staying in bed. They'll have fevers. And really the telltale sign is if they start turning yellow or jaundice. With severe liver failure, the liver numbers go up, the bilirubin goes up, and the children get yellow. And that's the telltale sign, and that's when you want to go into the hospital. Now, the good news is that the vast majority of children have fully recovered. However, it can be lethal. 5 children have died. 14% of the 109 have needed liver transplants. So there is the potential for really harmful outcomes, but to be but the vast majority recover uneventfully. So if you have a child that's sick, that feels poorly, and then starts turning yellow, certainly want to get them care immediately.
Is there any preventative care for anything like this, or just really what we have been doing for a long time, which is good hygiene?
Good hygiene, and be sure you're up to date on the vaccines, particularly your hepatitis vaccines. Now, clearly it's not hepatitis A, B, or C that's causing this, but if you have hepatitis A or B on top of this, that's certainly going to be a recipe for disaster. And so to be sure that your children are up to date with all the routine vaccines, and then just knowledge that it's going around. The Austin Public Health, all of us physicians in the city have received due notice about this, and we've been asked that if we have any cases of children with elevated liver tests that test negative for the routine hepatitis, that the authorities ought to be informed so they can keep track and monitor as well. So I think that's what's best for all of us, to monitor good hygiene, keep your vaccines, and be alert for yourselves and your neighbors.
Yeah, information is key. All right, Dr. Kumar, thank you so much. We always appreciate your time, sir. If you have a question for Dr. Kumar, you can email us at askdrkumar@gmail.com. Check out his website also, drkumar.com. We'll be right back.